Hi, so thank you for sitting down with me. So just to kind of start off, to let the listeners know about you, is there anything you would like to share right off the bat?
Um, no, I'm Dr. Ebony Parker Waugh, class of 1993 here at James Madison Nursing, and have been in nursing for 32 years this year. CEO of Parker Waugh Industry, or Parker Waugh Enterprises. I don't know why Industries comes out, but and it's really the parent corporation for my EPW Consulting, where I coach women to gain their confidence, discover their purpose, and then to walk boldly into it.
So when you think back on your time at JMU here, how did it help set you up to where you are now as a professional?
So when I think about JMU, the nursing department, very humble compared to what it is now. We were the largest cohort at the time, just 44 of us, and that was the largest cohort to date. But the education, the start that I got, felt very thorough. I felt like I knew I had it, the education. The nerves were still there when I started out in my first job, but just I feel like the education that I got here, from the small yet mighty team of faculty, prepared me very, very well.
Talking about the faculty, a lot of the conversation today at this summit has been mentors and sponsors and people who have helped progress people's career. Are there still people that taught you at JMU that you can still kind of reach out to, or at least think back on and how they inspired you?
So Dr. Vida Huber was the department director for nursing, just an humble person, very caring, very invested in us getting the information that we need and learning it, not just taking it in and being able to take the test and pass, but learning it, and being able to just care from a place where sometimes you have to dig really deep, right? Because the patients are in a vulnerable space. So just her caring nature towards us as students allowed us to be caring nurses towards our patients. Her heart, was so big she had a free clinic here, right? And so Dr. Vida Huber is someone from my time here at JMU that I will never forget.
How important have you found it now, years after you graduated, to think back and be like, this is someone who really did inspire me? How important is that, or have you found it to be in your career?
So for me, I often think back to our faculty. Virginia Livingston was another one. Merle Mast. Like I said, it was a small but mighty team of faculty that taught us. And it's so funny, I never wanted to teach anybody anything, is what I always said. Even having younger brothers and sisters, you play school, that was never me. But when I was in my career as a clinical nurse specialist, we were asked if we would be clinical instructors. And I thought, good, they come to my turf, I can teach them what I know. And I had my very first cohort of students back in 2005, just like they soaked everything in. And I'm just thinking, this is just a little something I'm doing, But they inspired me to actually go into the classroom, which was something I never wanted to do. And when I think back on it, the courses that I taught them were OB course and public health. And now that first cohort of students I still keep in touch with, actually had a conversation yesterday, but that's what they went into. So some of them are public health leaders with the public health service. Some of them are nurse practitioners, nurse midwives, having their own businesses. And they tell me all the time, had you not taught us, I don't even know if I'd have been interested in these particular areas. So it feels like it's a full circle from the caring that we got here, then to be able to pay that forward, and then to hear it come back to you is something special.
With the summit, the main theme has been stories and what your story is and maybe how it's changed. So when you're teaching that cohort, when did you start to realize that your story may be changing and where you thought you were going to end up and pursue going forward?
My story has been changing for quite some time and continues to change. I thought I would be a midwife. That's what I always wanted to do. Well, as a child, my mom was going to school to become a nurse, but was diagnosed with breast cancer and lost her battle at the age of 36. And so I was 12 at the time. And so I remember feeling very vulnerable, like not knowing how to help, and just all I knew was to be there and to show her that I loved her. And so I made the decision after she passed that I'm going to finish for you, but then I'm going to pursue nursing for myself so that I can have the knowledge. I can learn how to care for people who are not even family, and do that sincerely. And so as I taught the cohort and teach other cohorts, my story is constantly evolving because I'm still learning every day. And so it's something new to share. It helps prepare them for their journey. How I would always tell students, I want each of you, we would like demonstrate it in class. I was like, take your hand and put it on your shoulder and pat yourself on the back. I said, now make sure the other hand works, so do the other side and pat yourself on the back. And I told them, when you go to work and you come back home and you feel like you've done all you could do for that day, even though you may feel beaten down and have no energy to give anybody, take your hand, pat yourself on the back, take a shower, get some sleep, and come back tomorrow and do it all again. I said, because unless you learn how to appreciate yourself and what you're doing, even if no one says thank you, you say thank you to you and the care that you give.
You mentioned learning in that answer and how you were learning every day. How important is it to come into work in your daily life with that mindset of, I need to, learn something so I can make sure my tomorrow is better?
Oh, absolutely. I consider myself a lifelong learner, and anyone who knows me knows that currently, which I did not think. After graduating with my doctorate in 2009 and thought I'd never step foot in school again, I went back to become a nurse practitioner. So in T-minus, 20-some days, I will have my postmaster's women's health nurse practitioner certificate. So always learning. The Black infant or Black maternal mortality issue in the country is what drew me back from administration into clinical, because I know I've taken care of some really sick women in my years of nursing and helped them to bring new life into the world while also preserving theirs. And so I just wasn't sure what was going on in the world, but I knew that I could be part of the solution. And so to do that, I had to go learn another thing. So always learning, so that then I can share that message where we're never really finished. We may be finished with formal learning, but I think if we're not learning, then we're dying off, so to speak. So I just consider myself a lifelong learner, even if it's just looking something up and getting a better understanding for myself.
In your time getting your degrees throughout your time in colleges and around universities, when did you start to realize that becoming an entrepreneur and using what you have learned in the nursing field could be a possibility for you?
So it's so interesting. I have a fun hobby business, I call it, because it's more than a hobby because it makes money. But I have a travel agency. And so I just love to travel. And when I got the opportunity, I was like, sure, I can do that. So when I was helping others who also love to travel, but maybe they were just doing it for themselves, and I was showing them a way that you can talk to other people and see if you can help them and book their travel and that sort of thing. And when you would see the shrink happen, I'm like, there's a story behind that. Let's explore that. And so sometimes finding out it was the things from their childhood, the not enough, kind of kicked in when they had to actually talk with someone else about something, and they're like, ooh, I don't know. And so it's like, let's explore that a little bit. So it started off, I had to do my own work myself with limiting beliefs. Not that I wasn't enough, but I was just sharing this story with someone. I like to do things one time. So I ask all the questions so that I get the best understanding, and then I go and do the thing, right? And in my career, I've been told that's not what they wanted. And I'm like, then I need to speak with whoever the person is that gave you the instruction, because I only want to do this one time and move on to the next. And I had to say, okay, Ebony, where did that come from? And I know as a child, they don't learn this anymore, which I don't understand, but cursive writing. Mm-hmm. And so my mother was the type that practice makes perfect. So we'd sit down at the table and we'd write a sentence, and we'd write it and we'd write it and we'd write it and we'd turn the page over and we'd write it some more. And in my young 8-year-old third grade brain, I'm like, isn't it right yet? So that's what I was thinking. Why isn't it right yet? I've written it. And I was never told that it was wrong. Mm-hmm. It's just practice makes perfect. But in my mind, I attributed that to it's not right. When is it going to be right? And so that set my course for perfectionism. And it wasn't until I went back to see where it started that I could work on it, because there's no such thing as perfect, right? And so when I was working with these ladies in our travel business and trying to help them build their business, and I'm seeing the shrinking, I'm trying to figure out where that's coming from. And so I took what I had to do for myself over a number of years, and I condensed it to help them in their current situation. So I learned that that's where my dislike for doing things repetitively came from. Mm-hmm. Not that it was bad, but until I understood it, I didn't know. So I kept carrying it forward in everything I did. And so helping them, it allowed them to break through some of those limiting beliefs. And so you ask how I pivoted to an entrepreneur. It's then when they said, oh my gosh, like they've gotten an epiphany or a light bulb moment. That helped me so much. You should be doing this. You should be helping other people. I'm like, I don't know about this. But people started to come in just everyday situations to seek me out. And I said, maybe there's something to this. So I did some digging and, did some certification kind of things, and decided that that's what I wanted my passion to be, was helping women discover their purpose and then walking boldly in it. And so from being a nurse and being a leader in nursing, I could see behaviors that were like, oh, someone needs to probably help them understand why they do what they do. So it's like I have my own light bulb moments, and now interacting with people, I can now give space and grace, where once I was like, I don't know what their problem is. But I can now give that space and grace to let people be who they are wherever they are. So going from nursing into entrepreneurship, the leadership aspect of nursing has helped with that. But then life has kind of done a lot as well.
In today's society, how important have you found it to be someone who can support women in finding who they are and their true potential and self?
So there's a quote, and it talks about when women thrive, we all thrive. Right? So as the mothers and the bringers of life, right? When women thrive, we all thrive. So it takes empowered women to empower other women. And so it's something that now I fully embrace. I'm happy to talk about it. I'm happy to help someone. When we have that purpose, right? And that passion for whatever it is that we want to do, helping them to realize that they have everything within them to be whatever they want to be is very fulfilling, especially when you see their journey and you see their transformation, and then they're doing what it is that once was just a little, idea, and it's now, working for them, and they're impacting others. The fulfillment for me is big.
And to kind of go off of that, when you look at all of the things you've done, being a nurse, a travel agent, now helping these women succeed, what can you look at this point in your life and be like, you know what, that is what I am the most proud of what I've been able to accomplish?
So I tell people, regardless of the education, the degrees, all of that, my biggest accomplishment has been being a mother to my son, who's now 31 and is a father to his own little son. But that's my greatest accomplishment, right? Because that road wasn't easy either. But that's my greatest accomplishment. The other things were more what I set out to do. But being a mother to my son, and one that helped to pave the way for him to be successful as an architect that he is now, it took a lot. And so when he crossed that stage, it's like I crossed that stage again. So helping women really discover their passions and their purpose is fulfilling for me as well. And it's kind of right up there, but being a mother to my son is probably my greatest accomplishment. But then, like I said, I love seeing people go after what they desire and not listen to the naysayers and the people who are telling, the people that tell someone else, no, you can't do that, are the ones who don't go after their own dreams. And so there's a quote, and I forget who it is, but it says that graveyards are full of dreams that were never fulfilled. And so we can't take our dreams to our graves because there's no place for them there. Their place for our dreams is here among the living.
One of the themes of this summit so far has been the 3 words that kind of describe JMU to you and what it means. If you can, what are your 3 words about this institution and kind of how it's hung with you throughout the years?
So I came as a transfer student, so I had done probably 3 quarters at Ohio University. So I didn't live on campus. I had my own, I had an apartment, and I worked and worked. But my 3 words are my forever home. I came to JMU for the very first time for my cousin's graduation. And although it was freezing because it snowed that year, graduation of '89, I fell in love with the campus. I was like, I'm coming here. I didn't know if they had a nursing department, nothing. I didn't know anything about it. I fell in love with the campus, and the campus back then in 1989. So of course now my love just continues to grow because it's just the most beautiful place I have ever been. So my 3 words are my forever home because I came as just, a young girl from Baltimore who had challenges prior to even getting here with losing my mother and that sort of thing. And then faced additional challenges because although my dad and my stepmother allowed me to come to college, they didn't send me. And so I think there's a difference. They said, yep, you sure can go. We'll go right up to Kmart here and we'll get you like a pot and a pan and start you off and some sheets and towels. And the rest of it's on you to make happen. And so I just continued to figure things out. So my forever home for JMU is in the accomplishments that I had here, in the trying times that I've overcome, but I overcame them here. It was my launching pad. The people that I met who have become, who've gone from strangers to friends to family. And each time I come back, the memories rush in. So JMU is my forever home.
And as you said, you weren't a freshman here, but if you could give some advice to people that are getting ready to embark on the journey as a JMU freshman, kind of what would that be?
I would say your undergrad years are the best years of your life. Fully embrace it, right? Get involved, meet people. I came kind of as a shy, quiet person. I knew probably 2 other people here. And then my cousin came, who's very outgoing. And so then she kind of like is I don't know, maybe my little flower needed some fertilizer or something. I don't know. Maybe that's what she was for me. But once she got here, a semester after I was here, it's like we discovered this place together. And so I would tell them to take advantage of everything that JMU has to offer. Study hard, get your education, enjoy your time here, make lifelong friends, and then allow it to become a special place that you hold in your heart.
Well, that was everything I had. Is there anything else you'd like to add to this?
No, thank you for this time. I'm thankful to Women for Madison for the opportunity to come and speak. It's a topic that I'm very passionate about. And with the theme of this year's summit, her story, your story, our story, it felt very impactful to me to let people know that your story is constantly being written, right? Don't give the pen to someone else. You write your story. And that your story is not even for you. It's for someone else who hears it, who has a dream inside of them that they need to birth, but you kind of give them permission to say yes to that. And so, as messy as our stories can be, as imperfect as they can be, write your story, tell your story, and live your story.
Thank you so much.
You're welcome. Thank you.